profession, and I'm working for DIZ. And I want to introduce to you some of the names who are already sitting here on the table. First of all, to my right, Professor Kujunda. He is the Chief Health Officer from Sylhet City Corporation, and we are working together already for more than a year. The other two gentlemen are from ICDRB, Mr. Roman Zakaria and Dr. Fatih Ahmad, both working for ICDRB to help in the mapping exercise in the yes, you are okay. We don't know each other. Mr. Nasrul Islam, he is working, he's an urban planning expert working for UPR. And Mr. Islam, that's you. Okay, he is working for Google Map Maker. Maybe you explain a little bit what you do. Okay, good. So let's start with Professor Zimmerman with this presentation.
I am Dr. Sudhaman. I am Chief Officer of Sylhet City Corporation. Working from when we were in this project for 25 years back, and with Sylhet City Corporation. And Sylhet's municipality established in the year of 1884. The area also previously is 4.5 square kilometers, and now it is 6.5 square kilometers. Our actually ward is considered a population of about 6 last time from 6 kilometers. Stationary for mapping exercise, why it is urban private healthcare service provision sector, limited knowledge from governing body on how many entities, what services they are providing, location, and what is our present infrastructure, human resources capacity, fees, many entities, business and currently not registered with Sylhet City Corporation. What benefit? We have actually, I like to mention it here. About 1.5 years back, from Sylhet City Corporation side, I requested GIZ, our partner GIZ, to help us in health sector. As per my and our authorities in the one in Sylhet several times, and after long discussion, we come to the conclusion of what is that can do this Sylhet City Corporation GIZ. And accordingly, GIJ take some measure. One of them is mapping with the help of ICD learning. I show all my respect to GIJ as well as ICD learning. It is around adults. What are the benefits? It's clear. Here a picture of health services provision in senior city population. Database of all facilities is available. Geography map to visualize distribution, web-based software. Assist in decision making and planning. Integrated part of the sector health information system. We are doing health HMI and health information system with the active health of GL. I shall try to present it tomorrow with my another colleague. So, the next slide. New steps. Computerized trade licensing system to make it proper registration system. Register all the unregistered who are not registered. As I mentioned before, the senior city corporation becomes city corporation in 2002, but as part of the city corporation was outside the city corporation. So a lot of facilities are still not unregistered in our city corporation. So register all unregistered trade license, clinical license to practice in collaboration with civil servants. As you know, actually the municipality or city corporation are providing just trade license and no other involvement regarding the clinic registration or any hospital registration for city corporation or municipality. So, clinical license to practice in collaboration with civil servant because he is the office, because he is the member secretary of clinic license authority from director general of hospital. Address shortcoming in service availability. Availability of services after here. In mapping, our colleagues will show you where, when our workers are working, and it will be easy to understand this problem. Under served geographical area and services, that will be seen. Will be we see the next part. Set up information board to help citizens navigate the health services and community. Ladies and gentlemen, actually, three slides are in my hand. I like to show it. I already showed it to you. And after next presentation, everything will be clear to you. And after listening from your side, so we are in the symposium for 2 days here. To establish a city. So we welcome everybody. Let's come together to build a city for a better life. Thank you.
Maybe I
out the reasons what. I did not. Anyways. So he just laid out the foundation why we got into this. But for us, from the research perspective, why we got into mapping, these are the reasons. We had a concern around equity because we know there's a mushrooming of all these health facilities across the urban landscape. But we have no idea who are getting what kind of services. We're also kind of conceptualize the urgent need for planning and coordination. I mean, because evidence suggests and observation says that there are a lot of health facilities across the urban landscapes who doesn't have proper registration legislation, issues like that, and also some of the regulation around all the services. And we had another observation which is kind of overwhelming. The density of urban services may have limits choice in terms of, all these, although there is a lot of urban bias in terms of distribution of health, human resources. People like to, do their medical practices across urban landscape or their own money involved. However, not everybody is getting required services whenever it's needed. So these were the basic reasons why we got into mapping activity, and then thank you very much to GIZ. With the funding support from them, we decided to do this mapping activity based on this objective, which are mostly like we wanted to identify all the health facilities across the urban landscapes, and we want to create an interactive user interface where we can welcome these or host these data and kind of offer different sorts of analysis. And then finally, we had an objective which is like we undertake some activities which will have uptake of this user interface, which people can use it, policymakers, decision-makers can use it for more active decision making and planning across the urban landscapes. So how it was done, we did it in Symposium Corporation already. Sudhaman has talked about the ideas. So these were our three-step based method which we followed for the mapping. So we started with the facility listing where we created a comprehensive inventory. We kind of included everything, which includes pharmacies, health service delivery points, big hospitals, tertiary mass primary healthcare, EPI centers, stuff like that. And we also collected GPS coordinates of those delivery points. Then we created a base map by using a Google Earth image, where we overlaid all these coordinates to make it a base map and kind of try and identify all the road network across those city corporation areas. Then we undertook a specific facility survey which has these 4 categories of variables, which includes basics, particulars of the facilities, like what's the name and the GIS locations and type of facility, like who's managing it, like private, public, or stuff like that. Then we talked about staffing pattern, what kind of service, human resources are involved there, their training, numbers, part-time, full-time, like that. And finally, specific information around provision of core, like whether they have any sorts of provision for providing subsidized services or maybe free services for the poor. And that's what our definition was. I'm not going to go through this. If you're interested, we can discuss it later probably. And then that's the device which we used for our data collection, which is a eFlex Garmin GPS, but we later on found it's not really working properly because we encountered this sorts of problem. Across the urban landscape, there's always problem of accuracy of the GPS location due to the tall buildings, cloudy days, and stuff like that. So we came up with sort of an innovation. This is what is our current tool looks like. I love Samsung, but I am not actually marketing for Samsung yet. This is the device which we used recently for our data collection. What we can do with this device, that it starts with this desktop. You can look at that application which you have created, and you click on it. It gives you this is the Dhaka map, and you can focus on specific word. And in this case, we are gonna focusing towards 20. This is Ward number 20N is the City Corporation North, Dhaka City Corporation North, where you can, all these small points are at the GPS coordinates for different paths, and then you can go for live tracking with this tool. At the same time, you can correct GPS point. For example, this is where we're connecting the previous GPS point and connecting different dots to create a new and updated road network. You can also insert a facility. For example, this is a facility. We want to make it active. However, make it pretty specific. So we can draw by using this map on site, or maybe coming back to the base, we can draw that specific facility with the help of this tool. Then we also install a survey, which I already talked about, different variables. Currently, we are using a survey which is more like a web-based one. So after installing the listing tool and GPS tool, we use these platforms to go through our facility survey, which includes, which is basically made up from an open access tool, which is MySQL. You can use it, it's irrespective of the operation system, whether you're using Apple, Windows, whatever. And you can get output in Excel, spaces, whatever form if you want. And this is like a kind of aspiration, what we have learned from the entire activity. So we think mapping it is not easy. Why it's not easy? First thing, digital maps and road networks is very difficult. You actually have to walk across the roads to get the live feeds. So you have to be in reality in a defined area. You have to be in every inches of that. And of course, accuracy and GPS coordinates and stuff like that. So that's where we focus on the innovation part and the updates I've just shown you. The other challenging part was this huge volume of provider and how do you actually access these facilities, because these are private, a lot of them are like private entities, right? Why would they let you in and share their financial or staffing data and stuff like that? So that was pretty challenging. And updating, how do you update requests, involvement of different stakeholders and parties, and finally the duplication. This is really interesting. You go into a center in the morning, you find a doctor practicing there, you move into another facility in the evening, you find the same doctor practicing in that facility. So that's a whole lot of duplication. So how do you deal with it? We think collaboration is one of the ways which can help you work around this. And we are currently, with the help of City Corporation, City Corporation and GIZ, we are working on the collaboration framework, the way we can increase the uptake. And of course, focus dissemination and skill building is extremely important for uptake of this tool and make it more like used for more this informed decision making. Well, that's all from me. I guess Ruman is going to give you an update of how it's look like and maybe use in the real life setting.
Good afternoon to everyone sitting over here. My name is Ruman Zakaria. I'm a senior research investigator at ICTRT. I've been working there for the last 1 year. And I'm immensely fortunate that I get to develop this tool, which I'm going to demonstrate it to you now. What I'll be doing is I'll be going through a series of slides explaining how the tool works, and after that we'll have a live demonstration. We'll be describing a practical scenario and how to use this tool to solve the problem. Okay, so this is how our application looks like when it's fully loaded. On the on the bottom left corner, you see a bunch of buttons. Those are used to navigate the map. You can zoom in and zoom out. You can move the map around and also rotate them in different directions. On the right-hand corner, we have the Legends tool that is used to highlight the facilities at different criteria. So for example, I've highlighted them according to facility -5, and you can see the distribution. We have 90 government facilities, 101 NGOs, and over 1,000 private facilities. This is a distribution of facilities according to their type. You can see there are 22 hospitals, 121 clinics, and so on. Let's move on to the next tool. On the bottom right-hand corner, you see it's written, if you look closely, it says 1,251 facilities found. So if I click on it, I get a list of all those 1,251 facilities. I've highlighted one of them. It's Sylhet Divisional Police Hospital, which is a hospital, and it has 42 beds, 11 health staffs, and 21 support staff. And if I click on it, I get a more detailed information about this particular facility, and it also gets highlighted in the map as shown by the red spot. We have some other tools which are grouped into the filter tab. In the filters tab, we have the filter section, the service referral section, the search section, the radial distance, and the density map section. So I'll be going through some of them. The filter section is a very good way to filter facilities according to different criteria. For example, if I want to find out all the health facilities in Sylhet City Corporation that provide antenatal care, I can do so by clicking on service provided and selecting ANC. Now, if I want to, I see that I found out 225 facilities. If I want to go further and add more filters, I can do so. So say if I want to find out of these 225 facilities, I want to find out how many of them have MBBS doctors. I can do that. I've selected MBBS for doctor type. So out of that 125 facilities, 71 of them have MBBS doctors and provide antenatal care. Service referrals. Service referrals are a great way to visualize services that are sent from one facility to another. We have an extensive list of service referrals. I'll be choosing diabetics. So this is how service referrals for diabetics looks like. We are visualizing it with lines. So the red end part of the line is where from the service is coming from, and the green part is the receiving end. So the arrow goes from red to green. And we can see that there are two major facilities in Sylhet City Corporation that, where patients suffering from diabetes are referred. Let's move on to the next slide. This is just a 3D version of it. Density maps. Density maps are a very good way of seeing the concentration of facilities. So this is how Sylhet City Corporation facility density looks like. The red means it's highly concentrated, with green, yellow, and blue meaning least concentrated. This is a concentration map with heart disease. With facilities that provide services for heart diseases, you can see it's concentrated in some areas. So let's go for a practical demonstration. Say that I'm a owner of a pharmacy called the Green Pharmacy, and I have a patient who has come to me, and the patient requests ultrasonography. Unfortunately, my facility is not able to provide the ultrasonography, so I have to refer the patient to another center where he or she can get his ultrasonography, get the report, and come back to me. So let's see how we can solve this using the application. something went wrong.
Usually the problem with technology, it usually does not work when you want to demonstrate. I think that's absolutely normal.
Okay, I'll be very quick with it. It will take just 1 minute, 2 minutes. Okay, so I need to find out the facility, green pharmacy. So what I do is I type in the green pharmacy and I find it. Right, you can see that it's being highlighted over here. I zoom into it. And then what I need to do is I go to radial distance, set a perimeter around it. Let's reduce the radius to 300 meters. Right, so I have 17 facilities within this 300 meters. And then what I do is I go to filter services and I look for ultrasonography. I do a filter. Okay, so now I have 5 facilities. So I can refer my patient to any one of these facilities to get his ultrasonography done and get back to me. I had a few more slides to show, but I think I'm running out of time, so thank you very much.
When you want to know more about it, you can stay longer after the session is over, and I think there is a lot more you can learn with this. Okay, can I ask them the next presenter?
Good afternoon, everybody. My name is Nazul Islam. I work here as an urban planning expert since 2009. At first, I want to give thanks to my previous presenter for the nice presentation. And so far, I've understood that they have talked about the physical health of human being. As an urban planning expert, I am more concerned about the physical, social, and economic health of urban area. And you know, EPPR works to improve livelihood and living condition of 3 million urban poor people living across 31 cities under the program. Thanks Dr. Tanvi for introducing EPPR map that they use for mapping the health services. Now, I am going to give my presentation on how EPPR prepared the base map that they use. At first, I want to tell you the background history in few sentences. Towards settlement and vacant land mapping, in short SLM, it was first discovered and successfully implemented in Sri Lanka in 2001. Afterwards, a Sri Lankan consultant came to EPPR and he introduced this method in 2009. And after that, urban plan team of EPPR tested, rectified, and successfully implemented in 2 towns of the program, and the towns are Gopalganj and Tongi. Feeling the usefulness of the map and necessity of it, EPPR took initiative to implement it in all of the programs. Dear audience, now welcome to my presentation on post settlements and vacant land mapping that EPPR did in 29 towns and cities of Bangladesh. I'm in my presentation on settlement and vacant land mapping. So question should come at first. What is settlement and vacant land mapping? Settlement and vacant land mapping is a process that produces a product that provides the basis for targeting the most vulnerable communities who live in the town areas. It also provides the basis for preparation on town-wide poverty reduction strategies. Then what does it identify? It identifies and maps all poor settlements and slums, squatters in a city, and also it assesses their poverty status from 60 different perspectives of poverty indicators. This map doesn't give information of any individual household or any individual member, person. It gives information about settlements and vacant land. It is a very much participatory approach. It engages our community people as a surveyor, also the local government people. The SLM provides different sort of information: distribution, shape, size, location, age, household number of the settlements, poverty status through an index of 16 different indicators of poverty. It also gives information on distribution, shape, location, and status of vacant land. We have prepared settlement and vacant land map. Now, the question, how did we define settlement? What is settlement? For the purpose of searching out all 4 settlements across the town, we define the settlement of the households who have or who belong the sense of togetherness among themselves. It helps our purpose of EPPR. And the settlement size, minimum size we define where at least 2 households will live, will tell it as settlement. Now the another part, vacant land. What is vacant land? We take a parcel of land as a vacant land that is under unused and less used or underused business for a long period of time. And we identify all the vacant lands across the town so that it helps the poor for their settlement purpose as well as livelihood purpose. Now, what are the purposes for which EPPR did this comprehensive task in its program terms? Basically for 2 reasons: to inform policy and to improve operations. Specifically, SLM makes visible all the urban poor settlements to all involved stakeholders authorities. It also helps to prepare poverty reduction strategies, plans, decisions for making better targeting and planning. Also, it helps us to set a baseline in the starting of the program so that we can assess the maturity status at different level of the program. It also helps us to understand the dynamics of urban poverty and establish a sample framework for research also. And what else to improve the operations? As I told that UPPR works for the most vulnerable groups of the town, so we are required to find out the most vulnerable towns across all program towns. So it helps us to identify poorest settlements. It helps us to identify the gap for infrastructure needs. It helps us to identify vacant land parcels. Also, it helps to build capacity of the poor citizens. So altogether, we use 16 indicators of poverty to do this sort of job. Land ownership, type of occupancy, housing nature, availability of drinking water supply, sanitation facilities, drainage facilities, access to electricity, solid waste collection services, employment, monthly income, saving and credit facilities, enrollment of school-going children, civic facilities, risk and vulnerability, and social issues. And to collect information from each settlement, we prepared a question that is called a scorecard. So you see a sample of the scorecard. Here you see an indicator, and under each indicator there are 4 indicators. One is the host condition, 4 is the best condition. So the situation goes better from 1 to 4. And what the method we followed to complete this sort of job in our program town? As I told you that it is completely very participatory approach. So when we went go to a town, at first we make a meeting in participation of mayor, councillors, community leaders and all other stakeholders to make them understand the necessity and purpose of this map. Right? Okay. And we used Google Map to do this job, to prepare this map and for survey purpose, thanks to Google. And we collect survey from the community, what trade, and make this sort of investigation. And afterwards we organize this data, we use GIS, and again we go back to the town and see the results. When they say that it is right, they validate it, then we get approval from the mayor. So you can easily see the process in this slide. Satellite image, then base map, then we divide the word into a small block, then we put the shape. So if my time is, can I get to what is and then we put shape and location of the settlements here. This is how we complete the survey in all of the areas of the town. So I am just time is too limited, and we collect information regarding 16 indicators. We organize it, we sum up it, and we divide it into 4 groups to find out who are the extreme poor settlements, or very poor settlements, moderately poor settlements, and marginal poor settlements. This gives us this sort of map, and you can easily make your target to find out the most vulnerable groups of the towns. So I'm not going to say anything on it. So this is the aggregated data for 29 towns. And if you see, if you want to make thematic map, this is thematic map on the status of drinking water supply to all citizens of the towns. So this is the thematic map of the wards. So we have now the organized data, we have map, we have Google image that we use for this purpose, we have report, we have water atlas, our communities are empowered, our stakeholders are informed. So these are the things are available to UPPR, especially the information. It is available to urban planning unit of UPPR. If anybody thinks the necessity to collect it, just if you communicate with us, you can get it. Thank you.
Thank you very much. Now let's come to our last speaker. Mr. Alton.
future, since we are also mapping into mapping, after completion of my presentation, we will find ways to collaborate and achieve what we are trying to achieve. So, everybody who uses internet, PC, are familiar with Google and also Google Maps and various products like Solar, Maps, even Minecraft. Many of us are not familiar with Google Map Maker, which is the interface for developing the Google Map. So, what is Google Map Maker? As you know, Google Map is one of the most popular online map in the world. And for every search, every 100 search, 30 goes to location-based searches all over the world. So Google Map was launched back in 2005, but later Google found that for developing countries like Bangladesh, India, or Sri Lanka, map data are not available. Not because data are not there, because those who work those data are not ready to supply those data. In developed world, government or authorities who work map data then or collaborate with Google to execute those Google Maps. But in our country, there is no data available to Google. That's why they launched a new program, which is a collaborative program for developing countries in 2008. And country by country, they are opening this program to develop maps for countries like Bangladesh. So the Google Map that you see today are solely contributed by volunteers. So there is no authority data or data supply authority. So why we are mapping? Since Google Map is the most popular map and it's free to everyone, we can, or anyone who has a Gmail address can map or contribute to map through the map. So the concept is every citizen knows his or her neighborhood better than any other person living in other places. So by those contributions around the neighborhood, we can enrich the map all over the world, and mostly for countries like Bangladesh. So from every corner of this country, volunteers contribute to enrich the map of Bangladesh, and you can find a good map that is useful for everyone. And what we are contributing is a base map for everyone to use. So we are helping ourselves and so how we are doing it is by editing and reviewing. So in Google Map we can add new features or modify the existing features that are in the base map. And we can also help publish the pending map, which is through a system for new mappers who contribute to the map, don't get published immediately. So we have to moderate those edits and help the edits publish. And we can also comment or review existing features so that the map is enriched even more. So through this program, Google launched in 2011 earlier network program for each country. So Google was able to cope with a lot of inflow of data in the Google Map Maker. So they tried to decentralize the system, selected from each country various good mappers, good contributors who are trusted to help the program grow and help the edits publish more quickly. So from Bangladesh we have 10 regional experts in Europe and 2 advocates to talk with Google have like Dr. Alamgir, who is a teacher in the University of Kolkata, and also beside him is a student who is doing his bachelor. So you can see all kind of people, and some of them are living abroad for higher studies. So a little bit about the Matthew Bangladesh community. After the earlier program, Advocate program, we formed a community, an online-based community in January 2012. And so far, we have a growing number of members. At present, we have 900 plus members in our community who are continuously contributing. Every day, we are contributing thousands of pages in the Bangladesh app. And we have the 10 very active regional expert reviewers who are helping this English publishing every day. And the two country advocates, among one of whom is myself, is working for raising issues related to our country. And the forum is very active. The members are interactively having discussion to get solutions. We have represented in or participated in various regional summits in Singapore, Hyderabad, Jakarta, and recently you may have noticed in the newspapers that we have been holding map-up programs to create awareness and interest among the volunteers to map more. So what we have done in broad scale, we have mapped all the Udela healthcare centers, all the railway stations with railway lines. We have completed with high accuracy all the district boundaries, all the new flyovers or major link roads recently inaugurated. We have raised many issues and solved like previously we had a problem with the Bangla customer which was broken and Google solved it based on our demand, and we also got this unit for Guruna which was not there, and we are continuously having high resolution images for various areas of Bangladesh based on our demand. It was not much available to our country earlier. And we also got this river route for ferry routes based on our some pictures of maps you can see. And we have our own website launched a few months back, which is Bangladesh.org. We are trying to attract more people to. And I should stop here if any of you have questions like that.
So, are there any questions to the presenters? Yes? Somebody here in the back? Can you please introduce yourself?
One way because you have an offline budget property, and you talk about the stakeholders using the intended user. Is it only the health providers, or is it also going to be open to the general public? Because there's also big demand from that side where I can just go on choosing the around my home and compare price.
Shall we collect some more questions first and then we can answer? Are there other questions? Anyone? Otherwise? Yeah.
Hello everyone, I am from the Institute of Public Practice. Yes, I am a small query. What is your updating time? Because it is very diverse and always fact-checking this information. So, what is
two questions directly addressed to ICDFE, and then
All right, so from the ICPDRP part, I'll try and answer the questions. The first question was whether we can do it offline or not. Yes, we can do it offline. And the second question is, which is quite linked to the third questions as well, is something like, whether the community can themselves participate in using the platform or not, and how we can go for update of the system. Yes, this platform, what we did not show, because this particular session was more focused on presenting the tools to the audience, so we did not really talk about the diverse way of utilizing this particular platform. We are hoping when we are done and most of the part of the project has been implemented with the help of Special City Corporation as well as GIZ, we're hoping the service providers, like what Drummond just showed, like a owner of Green Pharmacy or Dr. XYZ practicing somewhere, policymaker, someone like Dr. Shudama Mutundar, who wants to expand the services, or any Mr. XYZ who wants to have a serial section for his wife to find her. So, which means the community service provider as well as the policymaker can be able to use it, but again, that is also linked to a larger process of going sequential capacity building, dissemination, targeted services, stuff like that, more like a module system. And for the update, I have no idea how we're going to update it at the moment, because we've just built a beta version of it and we are working around it, but I'm hoping that's one of the reasons why we're going to have this sequential dissemination, because we're hoping with the help of City Corporation being in the driving seat, probably all these stakeholders will be able to contribute and put their input over into this platform and help us update the case.
Thank you, Andrew. Your question was, because we have no idea about the facilities where it is located or like that. Now, from after the completion of mapping, we return to this workshop with our partner NGO and the government and other direct people, including the medical college hospital and civil service. And everybody is very much interested, and we have started work, because you have seen from one center to another center. Actually here you can, after this year, you can say the distance of from one center to another center is much. So in case of primary health service center, if you want to the patient to for delivery to nearest immunotherapy center, so we can they can use it. And now they are using our partner is can tell it the nearest center is very good or medical college. So it's very much useful for useful right now.
thank you. I said, then questions?
Hi, I'm Lynn Goodman from the Fred Hollis Foundation. We work in a vertical license and do a lot of prevalence studies and mapping of ICAPs. So just hearing about these mapping tools, I'm just thinking in the last presentation I saw that you mentioned a pilot that was done on social protection in slum areas. At the end of the year, 40% of the population they couldn't find that actually migrated. So what mechanisms are there in this mapping to account for internal migration and also seasonal migration for work?
Thanks for the question. I think if we have understood the question properly, it's like how we can get rid of address the in-migration, out-migration, because when you do perform a mapping, then you expect that a certain percentage of the population will be moving out or pouring into that. I I guess that particular presentation you're referring to, that's from my colleague from UPPR, because they did the initial one. But from our perspective, you were talking about the population estimation, and we are, at the moment, what we are doing is more like finding out the facilities, and the GISs are more like a static one, not the population. I have no idea how to answer your question at the moment based on evidence, but what I can tell you about the theoretical framework, there are available methods where we can go for an estimation based on your GIS points. For example, if you have idea of the center point of a particular delimited area, then you can use methods like T-square estimation and stuff like that, where you get an idea of what would be the surrounding population, and that can maybe be helpful for when you go for like round-wise big set. I don't know whether the government can.
So far I understood that you want to track the in-migration and out-migration of the people who are not right? So from my point of view, I think it can be done in two ways. One way is that now in Bangladesh, the Google images available, and from they update the image time to time, and you can track the changes from the Google. Another thing, as I showed you how UPPR prepared the post-settlement and second map, and here the people from poor communities, they work as a surveyor. So they are trained, local government institutes are trained, they can update the information from time to time for the sake of their own interest. It will not only help them themselves, but also to the others. So these are the two possible ways so far I can think now. Another way, as we told that protection. I do not know whether we have any information regarding the rate of in-migration or out-migration in Bangladesh. So if we had it, then we would be able to easily calculate this, how the number of in-migration and out-migration is. We do not have. And in this case, especially I would like to request Google, if it would be very helpful to us if they can work as the data bank of all information. You know, many projects, many parties are working in Bangladesh, and they do their purposive work. But if we use the common platform like Google Image that is available to all people, then we could use, GIS could use, they could use, and we could easily overlap their information or our information and could get used for our purpose. So if Google can take this initiative, I think it will get help to us. So that's on the platform for that.
Thank you. I'm Imran from the as Mr. Asam was saying that why I am here, I'm invited, I'm not so sure. Now I think you have the answer. I mean, the people already started using the Google as a basement because you people are contributing towards the greater benefit of the common people, Bangladesh of course, and also beyond the country. You people are using your Google Map as a base map, same priority everywhere because even we in the invitation card we invited the Google Map. We printed it out and sent it to all the participants. So nobody can deny the fact that we are getting much more used to Google services, whatever you are doing. The idea of involving or trying to involve you in the process, like you have heard that somebody was asking how the updating will take place. So you have the very good community all over the country, up to 900 members, and different capacity they are working. So I think because I mean this urban health symposium, I mean you could imagine or you have witnessed several breakout sessions. The speakers are really targeting the issue of how to address. It's not particular one issue. It's a complex issue. What sanitation, public health all together. Now actually we have to plan forward how to tackle the issue. And the mapping, as Dr. Anjuman mentioned rightly, so mapping is a greater part to visualize the intensity of the problem and also how to overcome the problem. I think, I mean, the dialogue has started and we will be trying to collaborate among ourselves. And in future, I can see like we have experienced open source based system with the Ministry of Health, and we started very small DHIS2 thing. Now it has been expanded all over the country. So it's open source. You don't need to buy anything. So it's the greater interest of the people. Same thing could be done with the mapping. So ICRP helps the mapping for the Dhaka City Corporation. Now GIZ contributed in Sylhet City, planning to expand to 3 more cities. So this is how the whole initiatives are being expanded. Now the sustainability part, I mean, it's not that ICRP one project is doing here and there, but ultimately government will take the responsibility in the future to sustain the whole initiative. That's why actually I think to make it much more open and how the people and community would really contribute in the process. It's not that people will be requesting UPPR, could it be send me your business, but you have to make it open so that people can, whoever is in need, so they could really connect it, download it and use it. I think that's the essence. Thank you very much.
Is this responding to that?
Another thing I want to tell for the kind information of Mr. Jamal, that I want to share one of my experiences that we prepared post settlement and interplanner. In that we have the location, shape, size of the post settlement. It prepares the program of UNDP. UNDP has another program, its name is CTMP. So they prepared disaster map of the same area for our 1,000 So we took it, and when you overlap it for all our settlement map to identify what are the possible threat areas for a particular disaster, then we could not overlap it. So you see, we spend money, time, labor for mapping the same area. They also spend the same for the same area. And if we cannot overlap it, it is just nothing but wastage of time, labor and money. So for this, we need to use the common platform. Otherwise, Dr. Tanvir has used GPS. We have used Google Images. They will use total station, very sophisticated tools, real-time kinematic GPS. But these will not match with others. So what they produce is really ends when their program ends. It cannot be carried out afterwards, and it cannot be used for other people who have already prepared their map. So we must have to have a common platform for utilizing all sort of information for all parties involved. Thank you.
Excuse me, it's 9 from DPL. And thank you ICDDFB and GIS for this type of initiative of mapping cities, and I think it's a starting of service availability mapping protocol, and it's very good for planning and also referral from the individual level. I call it individual level as it is used for individual organization or individual people level. But I think it's on my dream to make, I don't know whether it can be possible within this system, that's to make a system to find out the suitable location for next level of facilities, that might be possible. I don't think it is possible in the current system, or might be there another initiative. for suitable location analysis, and also the planning for the by some variables like demand, supply, and other things, the people's distance from the facilities and other things.
From Random City Corporation. While I was planning in December, I found this map, the invitation map. It was very helpful for me to identify the location of this center. And yesterday I was mapping, trying to find out a map of Random City Corporation. And while I went to the Google map, but the information was really in services. Because I was actually planning to establish two primary healthcare centers different locations, but it was very difficult to find a good map for that. So I was to make a plan and to get started. So we very here, and I was working on it, and created also working on it. Again, I found that Mapping Knowledge is also doing it, and they are providing the information to the Google. Let's say only 900 people are working on it, and they are providing the information and participating is being done. But whenever I see another parts of the world, I found all the maps very updated. So the 900 people is not sufficient to make a good and proper map or informative map. So I will request you to convey to the Google Maps so that more people will be involved to make a good map for communication. It's needed too early, because without a good map we cannot make a good plan also. And again, I am requesting GIZ as well as UPPR and ICDR will come in advance and help us to make a good map for us, and we will go with that map for a good plan for the development future. Thank you.
A little bit over time.
The question was whether by using this particular platform, whether we can kind of use some of the demand side and supply side information or not, and then whether we can use it for planning, actual planning of clusters. Is that right? Is that the question was? Cool. I mean, yes, you can do that. I think my colleague Kumar what he will do to this technological course in his laptop, he couldn't show it. Like, you can actually do it. For example, I give you an illustration. I am being a commissioner of a particular board, and I want to expand services. I do have some money from the government as a commissioner of a particular board. I don't know what services I should include. Or the mayor of the city corporation asked me to introduce a training program for the health workers in my particular ward. I don't know which one I should go for, right? That's a day-to-day problem that a policymaker at the local level encounters. By using this platform, what you can do, you go into your ward, you select it, you filter it out, the rest of the ward, and you focus on your ward, you identify what are the facilities those are having graduate level of medical training, undergraduate level of medical training, no particular licensing, whatever stuff like that. You filter them out, and it gives you a distribution of that portion of the ward as infiltration of a lot of MBBS doctor, whereas this part of the ward is not having anyone having a formal kind of a crowning sort of a medical training. So in that way you can identify what sort of training you can include in your particular ward. So yes, you can do that. And for the demand side one, it's more like a need-based thing you were suggesting. I mean, what's the need of a particular service in a defined area? Well, I don't know whether when we go for like more series of dissemination, and we try and create capacity within community level to use this platform, or we will be able to reflect it in the policy making as well in the future. Thank you very much.
Okay, thank you all the speakers for sharing their experience here in this session. I want to encourage you to go to each or every one of the speakers. Maybe they can open their computers again and show you some details what they have done. From my side, it is for us also a new journey that we just started. It is for us only a part. The data were collected only recently. In some cities, you are working now with DFID to cover more cities. We are at the starting point. What I am more interested in as a public health expert, it's not the technical details. I don't want to know the technical details. I want to use the data for better planning, to provide better quality services to the people. That's what we have to learn, what to do. Major challenges for us how to update this information, but there are a number of ideas we have to link it to existing registration mechanisms, linking it to what the government connects on the routine health information system. There are a number of ways that we have to experiment. I cannot tell you right now what will work best, but this is an experience we can all start together, and maybe in a year and 2 years from now, we can share with you the experiences, and maybe we have a better system than we have right now. Thank you very much for coming. I hope to see you tomorrow again in this symposium.
আপনি যে প্রশ্নটা করছেন না ফেসিলিটি পাওয়া যায় কিনা পাওয়া যায় আমি